Hi, my name is Margaret Kennedy, and I'm a registered nurse at Lancaster General Hospital. I've been a nurse for 30 years, and today I'm going to talk to you about evidence-based nursing practice. And this is my audience, my 3 children. Okay. We all have a mission or duty on this earth to help others, and the nursing profession allows us to do this. Nursing can be described not only as a career, but a vocation or calling to care for and help others. Until recently, nursing involved the bestowing of knowledge from one generation to the next based on clinical expertise, trial and error, tradition, and expert opinion. Today, nurses in different settings are supporting an evidence-based practice that includes research findings into their decisions and involvement with patients. Changes in nursing practice are happening every day because of evidence-based practice findings. Critical thinking skills, in addition to evidence-based practice methods for making clinical decisions, result in maximum quality and cost-effective care for our patients. According to Rossworm and Larrabee in 1999, the tremendous increase in clinical research and accessibility to research findings have prepared the way for the paradigm shift from traditional and intuition-driven practice to evidence-based practice. The most common definition I could find for evidence-based practice was from Dr. David Sackett in 1996. He described it as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. There's a model I have here of evidence-based practice, and it's integrated all to lead to the evidence-based practice. It begins with clinical expertise. This is doctors and nurses and scientists putting their input in, along with the patient's values and circumstances, such as their expectations, their concerns, their financial resources, and social supports. And that, combined with the best research evidence, leads to a good evidence-based practice. A little background here. Nursing has evolved a lot over the last 50 years. In the 1960s, it was more of an applied science, whereas it was based on traditions, myths, hunches, advice of colleagues, or outdated textbooks. The way we do things was the term. Nurses were considered helpers or assistants to doctors, and they spent a lot of time preparing instruments and equipment for use by the patient. Nothing was disposable, there was no plastic, there was no IV pumps or technology, and we all have seen and heard about the metal bedpans they used to use years and years ago. Well, I read somewhere that when they just put a towel over it, walked down the hall, rinsed it out, and then had to put it in this, they called it a bedpan washing machine for 3 or 4 minutes and stood there while it cleaned it all out, brought it out hot, and gave it back to the patient. So a little different than what we do today, and a lot of risk for infection and cross-contamination there, I would think. There was no code blues back then. People just died because we didn't have all the information that we have now. In the 1980s is when I started nursing, and I had a preceptor who taught me how things were done. I don't remember referring to a lot of policies or procedures or manuals. We did have ACLS, and we had code blues though. And then I was trying to look back to see when evidence-based practice was first introduced or mentioned, and it was in the mid-1990s. The experts realized this knowledge that we were using that was not enough. The knowledge needed to be transformed into clinically useful forms across multidisciplinary teams and measured to affect better patient outcomes. Nursing practice needed to change from tradition-based to science-based. And in 2001, the Institute of Medicine provided an alarming report that showed major deficits in healthcare and that caused significant preventable harm to patients. So they followed that later in 2001, 2002 by a recommendation that from these experts at the Institute of Medicine to employ or start using evidence-based practice. Using evidence to inform best practices was a way to fill this gap between what we know to be effective healthcare and what was being practiced. In 2011, this convergence of knowledge, quality, and new function in nursing, the nurses began leading interdisciplinary teams and improving delivery systems and care for the patients. In 2013, again, the Institute of Medicine provided a definition of quality health care. It read, the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So to obtain this quality health care, we can do this by standardizing all care to scientific best evidence, reducing variations in our care that are known to produce unpredictable health outcomes, and urging all health professionals to get on board and to join efforts for this healthcare transformation. Through the use of clinical research to determine the best forms of patient care, studying research, expert opinions, and all other forms of data, nurses can identify ways to provide optimal patient care. We're going to talk about some goals of evidence-based practice. The goals would be to provide practicing nurses with the best evidence-based data, to resolve problems in the clinical settings. For instance, we had the Foley catheter infections. So we have done, through evidence-based practice, we learned that we could get these out sooner to prevent infections where the hospital gets dinged for having, a number of infections. So that was resolving a problem at the bedside. Achieve excellence in care delivery, reduce variations in nursing care, and we do this through our policies and procedures so everybody does things the same way. But another goal is to promote effective nursing interventions and assist with efficient and effective decision making. So these evidence-based practice, this knowledge, this research information helps us in our decision making process. There are 5 steps in evidence-based practice. Of course, you first start with your assessment of your patient, the clinical decision, and then number 1 is to ask. You convert information needed into an answerable clinical question about the patient. Number 2 is you acquire. You track down this best evidence. Faster. Track down this best evidence for answering questions. Select appropriate resources. Then you appraise. You critically appraise the evidence for validity, impact, and applicability. Is it useful in our practice? Apply. Integrate the evidence into your clinical decision making. And finally, audit or evaluate these steps 1 through 4 and find out ways that we can improve. The nurse's role in evidence-based practice is to generate important questions, to ask those questions to yourself and to the doctors to help, see if we're doing this by the evidence. No basis for nursing practice. Expect that the evidence is the foundation of practice. Participate in evidence-based projects such as quality improvement projects. Disseminate project findings in various forums such as journal clubs and things like that. Collaborate with healthcare team to provide quality care. We do this daily in the intensive care unit with multidisciplinary rounds. Collaborate with the pharmacists and the doctors and pulmonary and everybody to provide the best care for our patients. Some barriers to evidence-based practice would be difficulty in changing practice. I was in one of my research classes, it said it takes 10 years to change something into practice from research to finding it. There's also could be a lack of administrative support, lack of knowledgeable mentors with the age of nurses retiring and everything. There's no time on the job to read research, and some people just get overwhelmed by the complexity of research reports. We can overcome these barriers through the organizational efforts focused on integrating research into practice and using strategies such as journal clubs, nursing grand rounds, case studies, and lunch and learns to bring this evidence to us. In review, the intended effect of evidence-based practice is to standardize healthcare practices to science and best evidence, and to reduce illogical variation in care, which is known to provide unpredictable health outcomes for our patients. The development of evidence-based practice is fueled by the increasing public and professional demand for accountability in safety and quality improvement of healthcare. Federal, state, local, and other regulatory recognition actions are necessary for evidence-based practice to be adopted. ANCC is the American Nurses Credential, require EVP in evidence-based practice in nursing through the Magnet Recognition Program, which we have at our hospital, and it's been a leader in the adoption of evidence-based practice and used as a marker for excellence. In conclusion, evidence-based practice is knowing what we are doing is the best practice for our patients. RNs who understand evidence-based practice are confident professionals who are able to communicate well with the multidisciplinary team and advocate effectively for their patients. Evidence-based practice promotes an attitude of inquiry in health professionals and starts us thinking about, why am I doing this in this way? Is there evidence that can guide me to do this in a more effective way? As healthcare professionals, part of providing a professional service is ensuring that our practice is informed by the best available evidence. We are transforming healthcare to best meet the needs of our patients, your families, and loved ones. Thank you for listening.